Do you want to give a brief introduction on the topic?
Yes, so today we'll be discussing insemination method for IVF cycles. So, which is whether we should do IVF or ICSI. So when you see your specialist for initial consultation, once your specialist understands overall your health and fertility parameters, so once they decided to do IVF, they have to decide which method to select for insemination of your eggs. So, and there are essentially two ways you can inseminate eggs in IVF, using just simple IVF or doing ICSI. So this is a very critical decision because this is one of the critical milestones of IVF, which is fertilization, and that determines one of the main factors which determines the outcome of your IVF cycle. So this decision has to be individualized. So we don't recommend doing blanket rule for everyone doing ICSI or IVF. So you have to decide on the basis of patients or couples parameters. So, and we will discuss later on how we decide which patient should have IVF and which patient should have ICSI, which patient should have split 50% IVF, 50% ICSI. So overall, in terms of the process for IVF and ICSI, what happens is on the day of egg collection, so the female patient undergoes egg collection. So at the same time, their partner provides sperm for insemination. So once sperm is provided, ejaculated fresh sperm, then sperm gets prepared. So using different methods. So you can use a centrifuge, or you can use a swim up method, or you can use microfluidics chips to select healthy sperm among the ejaculated sperm to prepare that sperm for IVF or ICSI. So that's when fresh ejaculated sperm is prepared. And also frozen sperm can be used. So frozen sperm, if it's ejaculated sperm, it can be used for IVF or ICSI. And if a sperm was obtained using surgical methods like TISA, TZ, then those sperm only will be suitable for ICSI. So taking all these things into account, at initial consultation, your fertility specialist will decide whether you will have IVF or ICSI. And then second, and this decision will be reviewed on the day of egg collection, depending on sperm quality. So you may plan for IVF. If on the day his sperm quality is poor, then it may need to get converted to ICSI. So now on today's live stream, we will discuss advantages and disadvantages of IVF and advantages and disadvantages of ICSI.